Well, COVID-19 is continuing to plague the Eastern Cape. More than 1,800 new infections have been recorded. Sadly, 69 more people have passed away in that province. To remind you, President Cyril Ramaphosa has declared the Nelson Mandela Bay Metro a hotspot with even stricter lockdown regulations for that part of the province. Advisor to the Eastern Cape Premier, Thobile Mbengashe, joining us now. Premier, Advisor, good morning to you, Thobile. Speak to me a little bit about what the reaction has been since these stricter lockdowns for the Nelson Mandela Bay Metro have come into effect. How do you think this is going to make a difference?
We really welcome the announcement of the President, and we think that is going to make a major contribution. One of the biggest challenges we've had is that people have actually assumed that the risk of getting COVID is very low. So we need to really bring the perception that there is risk, and I think the direction of really identifying Nelson Mandela in the minds of people makes them be aware. I think the second big thing that we really think is the limitations on the gatherings and the limitations on the sales of alcohol and the limitations of actually having big crowds, both where people are drinking, in funerals and other gatherings as well. Those are super spread events.
This does need to be balanced, doesn't it, Thobile, with us coming up to festive season, end of year for the economy down in the Eastern Cape and Nelson Mandela Bay Metro. I think many businesses were expecting to see an influx of those returning to their families and those coming down for holidays, albeit responsibly. That's now been taken away. Surely the province, from an economic perspective, is going to take a much, much harder knock, isn't it?
This was a major consideration in terms of the decision-making from the presidencies and ourselves, that we did not, there was no change in level one. But what is really important is that we have shown that the stringent application of level one restriction with the support of an enforcement, with the wearing of masks and social distances, we can balance the management of businesses and actually making people's life a little bit accessible. So this whole idea is really to make sure that we're able to control. What is really important, which I think is the message that the President is making and the Premier is making, is that if we all really make sure that we wear masks all the time, we can protect ourselves and protect others. We practice the social distance and the hand wash, and we make sure that we're not in big crowds. I think those will balance the business activities that are going to be happening in the province. I think that was a major consideration. That's why we didn't go beyond the level one.
Mr. Mbengashe, the problem with that is, and I don't think many people would disagree with you, that has been the advice from the beginning: social distancing, wearing of masks, hand sanitization, yet Nelson Mandela Bay Metro and its residents simply got this wrong, didn't they?
No, I think the key issues, this is really true. I mean, if you look at the experience in Europe and in Northern America and other countries that had had the waves before us, we always anticipated that there will be a second wave. The reason why that is true is that until the flattening of the curve does not stop the virus in the communities, it keeps in the low and it puts the lids on it. Once you leave that lid up, and you get a very rapid rise. So what Nelson Mandela did actually left the measures that were done very well. There are a number of reasons why this is happening. If you look in terms of our epidemics, we've got, actually this is very interesting, because in a province we have about 8 epidemics concurrently happening and overlaid by the provincial. So if you look at Sarah Baartman, you look at Sir Nelson Mandela, and you look at ourselves in the Western Cape, we share that kind of a continuities in the way how the spread is. So I think once the fire is lit, if you don't have the strong control, that fire gets out of hand. And I think this time it started at Nelson Mandela. Last time it started at BCM, this time it's at Nelson Mandela and Sarah Baartman.
Let's talk a little bit about the initiations issue. Initiation season, initiation schools cancelled primarily, Thobile, in Nelson Mandela Bay and that area as well. Do you think it's a good call or a bad call? Because it is a hot topic among cultural and religious leaders in South Africa.
It is a good call in this respect. Community spread is really a reflection of the level of risk. As you know, part of our biggest challenge in the Eastern Cape is to maintain health of the initiates and actually preventing death. So when you have the combination of the fact that we have always had bad results out of the circumcision, if you overlay that with a very high levels of community spread, then you are actually creating a double whammy within those communities. The idea of the circumcision is risk adjusted. So there is an assessment with the communities and the leadership and the traditional leaders about what the measures that are acceptable that can make the circumcision can happen. So there is really something that really is trying to save lives, respect the culture, allow people to continue with the cultural practices, but at the same time make sure that the stringent responses to the epidemic is maintained. We do worry about, and we're really advising communities that they should not be sending their children now in the rural areas, because basically the idea is that we should really contain the infection within the areas and act and deal with the measures to reduce the infection in those areas to protect the rest of the area.
I appreciate your time in speaking to us, and thank you to the advisor to the Eastern Cape Premier, Thobile Mbengashe, joining us to speak about the situation in Nelson Mandela Bay and the Eastern Cape, saying it's going to be a tough time for residents during the festive season, but it is all absolutely necessary. We'll be back with your headline.